Perfect. It shows we're live on YouTube and Facebook. Have patience with me, Charles. I'm just going to double check that we are live, in fact, and that I can share it on a couple of different areas so we can alert people that we're on. And if you are hopping on with us while I'm taking a second to share and post this out and everything, give us that like, the comment section. Please use that to let us know that you're here with us so I can see you and mention you. I love giving kudos where I can. Great. So we have several folks that are already with us. We're going to go ahead and get started. We were about a minute hopping on anyways, a little bit late. So I don't want to eat up too much of Charles's time or yours. I just want to give a couple of shout outs. Hello, Steve Ray. It looks like Chaz is on here with us, and Parker Brown. Good morning to you as well. Thank you for hopping on with us. I am Juliet Abdel, President and CEO of the Westminster Chamber of Commerce, and I am pleased to be here with you every morning at 11 a.m. with a different broadcast that helps you, your business, or your employees navigate COVID or just be aware of what's going on around you here in our city, county, state, and even nationally. So today's broadcast is designed to help those employees that may have transitioned different jobs, if they've recently gone on unemployment, or if you, your company, are looking to ramp up your workforce and you don't have something that's available to them in terms of benefits or packages, then this would be something that, that can supplement that and give you that competitive advantage. So before I go in detail on who I have with me and why we selected this program, you know I like giving the housekeeping rules, and that's if it's your first time here, don't let it be the last. Make sure you hit that like button, hit the notifications or follow icon that's on this Facebook page so you can get the timely alerts. Find us on Instagram, on Twitter at Westy Chamber, and also on YouTube, Westminster Chamber of Commerce. The video section of this Facebook page does have videos all the way back into March. So if there is specific content that you were interested in revisiting or you thought of that we may have already hosted or done, go back and see if a video has touched on it. If it hasn't, DM us, because we like to take up feedback, and that's really what guides who we bring on these broadcasts with us. As you've seen, I've just played this Good Morning from Parker Brown, and I usually will do this here at the start. So if you're on here with us, give us that good morning. Let us know that you're tuned in. I see Counselor Seymour, Wayne Anderson, hello, and good morning to you all. This is the function that we use, especially toward the end of the broadcast when we take up questions for our speaker. So if you have questions or comments, type them into the comment section, and we'll be sure to get to those during the broadcast and at the very end at least. And if you end up watching this video after we have finished being live, give us that hashtag replay so we know when you watched it and if you gained anything out of it. So enough about the housekeeping. Now I want to turn over to Charles. Charles is our speaker today. He is our partner on one of our affiliate programs through the Chamber. So one thing that we offer to any business that really affiliates with us or is interested in coming on board and they might see some perks that make sense for them is an employer-owned healthcare plan. And we were able to develop this, I want to say a few months ago, and really are trying to get it kicked off, especially during this time right now. The idea behind it is that we have a number of small businesses in the area that may qualify for some sort of a health plan program that they can then offer to their employees. And you do that by going through the Chamber and the Lens. But I don't want to botch anything by trying to go into more details. That's why I have somebody that knows it way more than I do. So I will mute myself. Charles, you can take it away.
Hi, Juliet. It's nice to meet all the members of the Westminster Chamber, and we appreciate you letting us be on today to speak with you about healthcare and also medical insurance for your groups that may have a number of employees to a small number of employees. So let me kind of give you a landscape of how health insurance and medical insurance works today. So we created what the company we represent today is called Associated Health Plans of America. And what that means is that we work with associations and chambers to provide their members with a different healthcare option than the current state exchanges that are ran and under ACA compliance, okay? So what we have offered through the chamber today to you is a level funded insurance program. It is governed by ERISA law, and not the ACA law. And the reason why is because in this program that provides both the group and all of the members and their dependents insurance, we kind of go by the old way of insurance, which is basically underwriting the group as a whole. So when we do that, we create an incredible opportunity for a cost reduction compared to the ACA plans you may be with. Now, for all fairness, this is not for all groups. So if you have a large group or a smaller group, and you may have some major health concerns within that group, you may not qualify for that actual plan. However, if you do have a widely healthy group with one or two unhealthy folks, that may be a great idea for you because it's going to give you a lower cost plan. So these plans are called level funded plans. And because they are controlled by ERISA law, and because you are representing your company when you underwrite all your groups, you automatically are going to own this plan. So it's a little different than if you went to the ACA plan today. And here's why. As the owner of the business, you will own the account. We have what we call stop loss insurance on top of the account. So what that means is we take all of the underwriting information of your members, we gather it together, and we project what your healthcare claims are going to be on a monthly basis. We buy another policy, which is called stop loss, which is basically reinsurance. So if you go over that at any 1 month, we will cover that with extra insurance. Now, the very positive part for you and your employees is we have 3 healthcare networks, which are very popular and handle pretty much anyone in any city or county you could be in Colorado. But the really big positive is if you promote this correctly to your employees and they use the wellness plan and the free teledoc plan that's included with this, what it does is it brings down the healthcare costs. So if you do not use all of your designated claims fund, which will be pretty much dictated when it starts and when the plan is underwritten, if you don't use all of that, you can get up to 100% to 50%, depending on what plan you go with, back at the end of the year, which can be applied to the group's premium next year. So what that does is it definitely helps you control cost. And then the more healthy your group is during the year, the more they will have a decrease in premium the next year. And there's no tax implication to you if you credit it to the account and pay it through healthcare. So there's no, you may get, let's just say I had an insurer the other day refund over $150,000 to a group of 100 people because they were so healthy that year. So that just went to pay basically 2 or 3 months of their total premium for the group. So it just takes a price away from you, takes price away from your employees. Now, we do have 2 different options for carriers. So as those options continue, there is a minimum amount of 50% of your employees that need to be involved in the plan. And that has a different reimbursement than the one that allows you to control how much you spend and how much you contribute. So you can contribute anywhere from 10% all the way up to 100% of the employee's cost, or you can contribute any amount you would like. And depending on how much you would like to contribute will depend and dictate which plan we put you in. So there's a lot of options. Juliet will have a site. I believe Westminster already has the link to our Associated Health Plan site, and you can go there and navigate through it. We also have a local individual that can help you navigate questions later on. But I think what I'll do, Juliet, is open it up to some questions. I think you probably have some coming in or may not, but I'll kind of open it up. So maybe I'll start with one question I always have when I do this. Why would I do this plan instead of go to the ACA? Well, here's the one big thing is price, okay? It will be basically the same health plan that you can buy on the ACA. The difference is you are going to get about a 10 to a 30% swing on price. If you are a healthy group that fits in the parameters, I will tell you, you will get anywhere from 10 to 30% discount on the ACA plans, which is an incredible opportunity for your folks that are paying a lot of money right now for healthcare. So that's one big question. The next big question is, what are the networks? Okay. So we have 3 different networks. One is the multi-plan network. The other is Aetna, which is the first Health Net network. And the other network is Cigna. So all 2 plans have different network opportunities, and we can work with you with any network that you may feel is best for you and or your employees. So what we do is we work with the owner to find out, what do you want the plan to look like, deductible sizes, co-pays, etc. And then we let you work with your employees to have an open conversation of what they would like the plan to look like. And then ultimately you as the employer make the decisions on how their plans will look and how many plans we'll offer. Typically, what we try to tell you is to pick 1, 2, or maximum of 3 plans that you want to offer, meaning different deductibles and copay size, so that they don't have too many options. And we do help you we look at about 40 or 50 different options for you as a group. And we only go back to you with about 6 solid options so that you're not confused on what there is to offer you and your employees. Healthcare is very complicated, and we try to simplify it through this process and try to help educate you and your employees so that you have good coverage and you're protected through the process and don't pay more than you should pay for the product and services.
Well, thank you for kicking it off with a couple of questions. For those of you that have popped on here with us, we have Charles, and he is talking more specifically about the employer health plans that are available. You can actually apply through them through the chamber. Excuse me, if I don't choke to death, you can apply to them through the chamber. And I have actually included the link in the comment section. It's what happens when I try and be healthy and I drink this green stuff every morning. End up taking whatever it has in there as well. So the link is available to you. You can actually navigate through the chamber website. It takes you immediately to the portal where it asks you initial preliminary screening questions. It talks briefly about some of the basics behind eligibility and things like that. We did have a question come in, and it comes to us from Counselor Seymour, who's asking, is there a group of 1 that would be available through this program?
Unfortunately, no. The groups have to be at least 2 or more employees. So it could be you and another employee, but it cannot be your spouse as the other employee. Under the group laws through whether it's ERISA or ACA, you have to have more than 1 person. Now, for the individuals, Juliet, and for Rich's question, we may have a single individual policies that may be coming available in Colorado in the next 30 days or so. So when that occurs, Juliet, I'll let you know so that you can let your members know if they want individual coverages or if it's just a husband and wife coverage.
Yeah, and I think that would be terrific. That's a great news. I know earlier on, once we did launch this, that was a few of the questions we had received was, do we qualify? Our community is predominantly small business, and we pride ourselves as a chamber for having a lot of solopreneurs or those entrepreneurs. So when they're first getting started, it is 1 person that's trying to do every single thing in that company or business. So I'm going to cross my fingers that it actually does go through here in the next 30 days. So you touched on.
Yeah, right now, Julia, just so everyone knows, we're working with the Department of Insurance in Colorado to get the individual plan completed. We have it in 48 states, but unfortunately, we're just waiting on DOI approval through your state.
Excellent. And if you need any help advocacy-wise with that, you know where to reach me. So I'd love to help with that. So you touched on a variety of partners that you go through for those health plans. You're predominantly your Aetnas, your Cignas, and some of those entities. For somebody that doesn't fully understand insurance, and I think a lot of people don't fully understand it, I'm not trying to discount this. I mean, I despise looking through my insurance. I actually have a good friend of mine who does that stuff. And so as soon as it comes through, I give it and I say, this is what I want. You look through it and you decide and handle it for me. With that being said, how are you seeing a difference between going through the market pricing wise for someone as opposed to benefiting from an employer plan that's available to them?
Okay, typically on the individual plan, on an ACA plan, you're going to get a better benefit being with a group, because here's how insurance works. And I'm an insurance geek, Juliet, so this is a very exciting subject for me. But here's how it works. So you have an insurance carrier. Then for health insurance, you have a network that they choose to have what healthcare facility or service physicians manage their insurance product, okay? And in this scenario, we also have reinsurance set up on top of it. So what happens is, because we're underwriting it, we're able to provide a lot better product. Even if you were on the ACA group where everyone can get in, you'll get better pricing for your employees as with this group, because you just have a larger group and the carrier can underwrite it and basically spread the risk a little better than just writing maybe Juliet and your family with it. So it's just a little bit different, and it does allow, all group policies allow a better opportunity for a lower cost than you would on the individual market.
These plans would cover your medical, dental, vision, or is it just medical plans that are available?
So both of the plans we have include medical and medical, and then vision, hearing, and dental coverage options to be added to both of them.
With everything going on, how does what's the overlap that you're seeing? So right now with COVID, there are several doctor offices that have transitioned to more of that video type of appointments. So some are still allowing for the in-person, and when they're allowing for it, they're really doing maybe 1, 2, 3 patients, and then the rest they're trying to book as video calls or phone calls. How does that overlap with the teledoc program that's covered in there? Is it classified as one and the same, or is it still a doctor's visit even though it's taken a different look?
That's a very good question. So here's how, so the teledoc feature in here, it's called Medline Clinic. And as the group signs up, every individual will be assigned to a virtual physician, which will be separate from whatever daily physician or doctor or specialist you go see. The big difference, Juliet, is this. The Medline option, which is the teledoc, is free, okay? So there is no copay when you visit them online. There is no doctor visit. There's no deductible at all. The other big thing for the group, let's say Juliet has Juliet Apparel and you have 100 employees, and everyone has little kids that are always getting the sniffles or fall down and hurt themselves or get a rash. They're no longer going to be going to the doctor unless the physician online says, hey, get to the emergency room. That's something that needs to get looked at. So the big thing for the Juliet Apparel company is, if most of your people start using the telemed and are comfortable with that, that telemedicine person can do their physical, order their labs, order their medicals, and there's no copays, there's no anything. The big benefit to Juliet Apparel is that that doesn't go against her company's actual claims cost. So it reduces your claims cost because you're not spending a lot of money in the plan. You're still getting your health care. So at the end of the year, Juliet's Apparel is going to get a bigger refund back to her company that she can transfer as a lower premium to her employees the next year. So that is one of the biggest things. In fact, I would say right now, the trend is, I talked to some of my affiliates at Aetna and Cigna, and basically it's turning to almost 70% of the people today are using the telemed versus the actual physical physician right now. And that trend is continuing to improve every day.
Yeah, I think that's a huge benefit, or I would imagine it's a huge benefit to the employer to have that. So in your line of work, and I know this was a fairly newer program whenever we started talking about it last summer, and then we really got it in the works a few months after that. How do you see this unfolding in Colorado? Since you do love insurance, and most people that are in insurance have this like weird interest in it. So bless your heart for loving it. How many people across the state, or how many employers have you seen already start opting into something like this in Colorado? Do you have those data or figures that you can share with us?
Right now, not in Colorado. I have the figures for because we started in Colorado with the Westminster Chamber specifically, and I know we're just now rolling it out to the individuals. But we have it in Texas, Georgia, California, Arizona, and right now we've got about a 90% approval rating on the underwriting, because that's another big question that Juliet, I didn't bring up. People go, well, how many of these groups are actually passing underwriting? So in our underwriting world, we've so far, I guess in the last 60 days, we've underwritten about 500 different groups, anywhere from 20 people to 200. Of those groups, we've had a 90% approval rating in underwriting. So that's a big deal, because a lot of people say, well, how do I get kicked out and how do I not get kicked out? What everyone needs to understand, or hopefully they will understand from this conversation, is most people in America are healthy. They're for the ACA plans, whether individuals or groups, those are very important for the folks that do have medical issues, do have issues that won't let them get into a group like this, which that's what the ACA was designed for, to help all of those individuals have fair access to insurance. But what we're doing is, if we can take 90% of the groups and push them into this plan and give them a 10 to 30% discount, we want to do that. And that's kind of what's happening right now across the Midwest and the Eastern states.
Well, now that I have a benchmark for Texas and some of the other ones, we're always better than them in everything. So we need to change that for sure. My competitive streak is going to show. So Marquez is on here with us. Hello to you. Thank you for hopping on and engaging in the last several. I'm always intrigued with some of the questions that you're asking. So this bulk of questions is no different. He is sharing that these are great comments. What new InsurTech trends are you seeing? Which ones do you think will be sticking from these newer developments? And then, are there any new healthcare offerings that venture capitalists or VCs should entertain investing in?
Well, so the InsurTech industry is really ratcheting up a lot when we look at the cost and we look at how do we save money and how do we provide better in immediate coverage and healthcare access for individuals. So InsurTech trends are very vibrant. One issue that always comes to play when you deal with the InsurTechs is the Department of Insurance. Every state is ruled by different Department of Insurance groups, and they all have their own regulations and requirements. So sometimes that holds us back when the InsurTech company has a great idea or something that they want to pose out there. They do have to pass muster for every single Department of Insurance in all 50 states. So that's one of the big things. Which items are sticky? The biggest item that is sticky right now is what we talked about, a teledoc process, whether it's called Teladoc, Medline, they're all just a little bit different. Those are the big things, and what the industry and InsurTech is trying to push clients to go to. Most of us know when we go in for a physical, you're going in and the doctor orders your paramed exam, which is the blood. You do your blood, you go see the doctor, and nothing's really going on except analysis of what the blood results were. Those are easy things over the phone. And one thing that's sticking really is that individuals with children, whether they're single moms, families with children, the teledoc is really important, because a lot of times as a parent, you stress out, especially with that first child, you're stressing out 24/7 every time something happens to them. And that teledoc creates a very comforting process that can gauge whether you do need to run to the doctor or not. So that's the biggest stickiness, is that teledoc, because what it's doing and how it's going to revolutionize healthcare is most of the carriers and underwriters are seeing about a 30% reduction in the loss cost to insurance. And what that's going to do is push down all of our insurance premiums. As we can control that And as InsurTech can bring technology that improves that process, we're going to push down that premium, which is really important. So when I'm looking at a VC, and I talk to a lot of VCs, a lot of private equity companies, they are really looking at that as how do we improve the technology so we have better virtual physician visits? And then how do we eventually start doing individual ultrasounds, things like that from the home? So there's a lot of options and opportunities in the healthcare with VCs and private equity groups, but that's the real big sticky point right now is doing that. And they're trying to get the technology in place. In fact, we've used a couple of InsurTech companies to develop the technology that Juliet has embedded into the Chamber's website. And a lot of that allows everything to be electronic. Used to be everything was on paper. Now everything's electronic in a HIPAA secured portal that everyone puts their private information in. It's all HIPAA secured. So that's another big thing the InsurTechs are doing for us. They're helping us create portals that before were never approved by HIPAA that now have so much cybersecurity comfort for the HIPAA groups that they're allowing that to happen. And that's what improves processing, reduces cost, allows us to provide a product for less money that's going out so that we can get the premiums as low as possible.
Mm-hmm. Yeah, I think that was an excellently worded question. Great answer that you've provided to that, especially to give us an understanding. And it has some really great positives in the long run. I mean, you mentioned that 30% reduction in loss cost that hopefully will eventually transfer into premiums and those programs that are available to the employers that are trying to support employees. We are nearly to the 30-minute mark. So before I start closing out and everything, I want to ask this because sometimes people will often ask the question. We mentioned earlier about the groups of one and how that is something that we're hoping to get started here in Colorado in the next 30 days. Hopefully that happens, if not sooner. But the idea of employee, how is that classified as it relates? And I'm just going to pull up his comment just because he did agree. It's very, thank you for that information. Shows how much you know about what you do. So when people ask sometimes the number of employees, does that count also your contract employees as well? Or are contract workers not classified as employees when you are applying for any of these plans?
We do have an option. It also depends on what plan, but there is an option for the 1099s to be included with the employees. There is one plan that doesn't include them as an employee option, but usually we can add the plan and add the 1099s with the employees.
Mm-hmm. And it would then be available to both the contract employee. Do they have to opt into it, or is this plan available to them since it's a part of the company that now has it?
That's a great question. Here's how it works. So Juliet Apparel has 100 employees. What we do is we underwrite the entire group, okay? And what we do is we underwrite it. And as people have their husbands or wives work for another company, have insurance, or maybe in the military, et cetera, part-time, all of those people can opt out. They sign a waiver and it just waives their coverage. So there may only be 60 of Juliet Apparel who join when there's actually 100 people. So it's their option to opt in or opt out. But they do have to have a reason to opt out. They have to have coverage elsewhere. If they don't, they need to opt in.
It's definitely great to know. So, Charles, if people want to reach you with any specific questions, I know I've included the link to where that they can actually apply. That's on our westminsterchamber.biz website. We have the direct link to the actual application that's included. Be sure to check that into the comment section. But if they have questions after watching this video that they want to direct to you, is there a phone number that they can call or an email that they can send those messages to directly?
Sure. For any questions and comments through the website, there is a email for information. They can reach me, and if you let me put it in the chat real quick.
Yeah.
And I'll let everyone have it because it's just easier if everyone sees it.
Yes. Thank you. Thanks for saving me that time of trying to type away. So while Charles is doing that, I just want to thank you all for taking some of your morning to spend it with us. For those of you that do watch this on replay, give us the hashtag replay. Let us know how much you enjoyed hearing about insurance a little differently, and hopefully gain something out of it. And if you do end up applying to this program, we also want to hear your feedback on the simplicity of the application, what that looked like, and if you have if there was essentially any problems for you as you were doing it, or if it was just a smooth process. That type of feedback helps us in the long run, and it also helps to make sure that we are taking care of any future applicants as well. So the link to the actual application is in the comments section. Information or questions, you can direct them to Charles. I'm copying and pasting all of his comments below where you can reach him, his email, and his phone number as well. He spent the morning with us sharing about this newer plan that really launched with us here in Westminster. We're hoping to grow it over this next year, and also offer it to people that are less than 2 employees, which is the current necessary requirement to be applying into this program. We will be back here tomorrow at 11 a.m. And I'm excited because tomorrow we have with us Servicios de la Raza, which is a nonprofit that serves the entire state of Colorado. They're located in Denver, but they specifically support a lot of our minority communities, and especially during COVID, have been the boots on the ground to make sure that a lot of people are taken care of. So I'll be here with Rudy tomorrow at 11 a.m. Bring your questions and your learning cap on so you can gain an idea about what this nonprofit's doing, things that they've been behind, how they've weathered COVID, and ways that you can engage or interact with them as well. Hi, Anne. Thank you for hopping on. This broadcast will be available at any point in time for you guys to re-forward and watch, especially if you're hopping on toward the end. And I just want to give a thank you to Charles for spending the morning with me to educate us from his lens and give us as much information as possible in such a short window of time. So thank you and have an awesome day.
You're welcome. Thank you guys. Bye-bye.